This is one of the command centers where U.S. government workers are tracking the spread of the AH1N1 swine flu virus. They work around the clock, collecting data, passing it along to other agencies, and formulating contingency plans to meet various possible scenarios if the situation worsens.
Number one, is DoD going to be able to provide transportation in an environment where we have a large number of infectious people?
Employees at the Department of Health and Human Services Strategy Center in Washington have been coordinating the federal response to swine flu since the government declared a public health emergency in April. Since then, the AH1N1 virus has spread to every U.S. state, sickening hundreds of people. President Obama says sharing information is critical to staying on top of the situation.
We are essentially ensuring that in the worst-case scenario, we can manage this appropriately. Government working with businesses and individuals, the private sector, end up containing an outbreak.
Over here we have
Tom Sizemore manages the day-to-day operations at the HHS Strategy Center. He says they plan for all types of public health emergencies, but they didn't anticipate a flu outbreak originating in Mexico.
Although the playbook said this would start overseas, it didn't. But plans help us determine what we will do next, no matter what happens.
To slow the spread of the epidemic, several communities have closed schools and told workers to stay home if they develop flu-like symptoms. The government also imposed restrictions on travel to Mexico, which have since been lifted. Healthcare workers are also focusing on rapidly collecting and verifying new cases while tracking outbreak history. But critics say the measures are an overreaction since the current strain of swine flu may be less lethal than earlier feared.
And it's for 24 hours.
Sizemore disagrees. He says an aggressive response is needed to limit deaths.
Nobody wants to go to bed at night and say, gee, I should have done A, B, and C, and I didn't, because someone was going to criticize me for doing that, and now people are dying.
World health officials are alarmed because humans have no apparent immunity to the new virus, a combination of avian, swine, and human flu. Back at the HHS Command Center, Sizemore says his colleagues are watching the spread of the virus in Latin American countries like Chile, Brazil, and Peru. It's winter in those countries, a time when seasonal flu normally peaks.
As their winter picks up, they now have the seasonal influenza plus the H1N1. There exists the possibility that the H1N1 could mutate, could become more severe. If that happens, we want to watch that.
Meanwhile, researchers are rushing to develop a vaccine, a process that could take 5 to 6 months. Once it's ready, the World Health Organization says various countries will decide who will get the vaccine first. Chris Simkins, VOA News, Washington.